This is Dr. Robert Bates at the Concussion Center of Fitchburg. I hope everyone's doing great today. We're going to provide a brief description of a computerized balance plate today in relation to differential diagnosis when there is a mild traumatic brain injury or concussion. A dynamic computerized force plate is nothing more than a flat plate that has dynamometers on the bottom that give the pressure of each sensor in relation to whatever is on the plate. So because of this, with the computer system attached, we can see the various sway patterns and how stable balance is, and in which ways or which sway patterns it has in the dysfunction. So I happen to use a balance plate by Balance Tracking Systems, and at the end of this short video we will show pictures of the unit as well as some reports that you can get from the unit. But in description of what the balance plate actually gives us, it gives us a mechanism to understand the interrelation of three major systems, or the integration of three major systems in the brain that give us balance. First of all, 50 to 100 million, or actually billion neurons in the brain may be injured in concussion, and therefore we see many different types of concussion. And in fact, I have never seen the same symptoms in any of the hundreds of patients that I have worked up for concussion. The more specific we get with diagnosis, as we do with a computerized balance plate, the more we can see these differences, and of course the more we can provide more specific care that renders a much better outcome assessment. The force plate actually is used in this way, and we use it in other ways which I will cover, but the major diagnostic criteria is that we look at 4 sway patterns in 4 different types of use. The first is we use the force plate with bare feet on a hard force plate with eyes open, and therefore we are looking at hopefully the best balance of the patient, utilizing the eyes, the ocular input, the inner ears, vestibular input, including otolith systems for translation and gravity, as well as semicircular canals for angular acceleration, as well as the somatosensory input, which is all of the sensors in the muscles, tendons, ligaments, joint capsules, in all parts of the body. Very specifically, the bottoms of the feet, the plantar aspects of the feet, as well as the ankle mortise, give a lot of good information about what's happening in the feet, as well as the upper neck, which has the highest population of mechanoreceptors in the entire spine. Actually, the research shows that about 50% of all of the mechanoreceptors are in the upper couple segments of the neck. So when all of this is working well, about 80% of your brain is utilized in doing one thing, gathering all this information so that you can move safely in your environment. Everything else is very secondary to that in the brain, actually. So the first sway pattern we look at is with all of these modalities firing. The second balance that we look at is with the eyes closed on a hard surface. So now we're looking more at somatosensory and vestibular input. The third input we look at is with a soft foam pad on the force plate. So then the sensory corruption from the somatosensory system is high, and your body can't use it that well, so we look more at the eye and vestibular integration together. Fourthly, we look at the force plate sway pattern created when we close the eyes on a soft surface, and we are relying more so on the vestibular system. So that is a very short and brief explanation of use of the force plate. And we can also use it with various head positions to change neck input and vestibular input if we want to do more specific differential diagnosis. If you have any questions concerning a force plate, then you can look at my website, which has some information, Concussion Center of Fitchburg, or you can always call me and I will get back to you when time permits. Have a great day.